Hey, Dr. Alan Christianson here. So, when did you do your last neck check? This is an important thing. There's awareness about the power of screening, and cancers are on the rise. None are rising more quickly than thyroid cancer among women. And we understand that the earlier cancers are detected, the better are the treatment outcomes. Thyroid cancers are caught in three different ways. They're detected by doctor's exams, by ultrasounds, and by self exam via the neck check. The last one can be one of the largest ways that it's caught early. So, super important thing. It's a habit I'll encourage you all to do once per month, and it takes us all of a couple minutes. So, who should do this? Well, anybody who has a thyroid should do it. And, those prone to thyroid disease are even more at risk. So, it's even more relevant for them. What do you need to do it? Well, really just a mirror, handheld mirror, and a glass of water and your neck. That's about it. We'll use those props here in just a moment. So, how do you know what to check for? Here's the thing, when you're checking this, the real value is not so much can you detect something abnormal, it's can you detect something different. That's what's really powerful about self exams. Doctors are trained to detect what's normal and what's abnormal, but no one will know your body better than you will. And you're more aware of when something is different for you. So the drawback about that, though, is the first few times you're building up your database of knowledge. You're not as sure what normal feels like. Some will do their first exam while they're doing a doctor's visit so they can get some feedback right away on what they're feeling. A big point to know is that a normal thyroid, you actually can't feel it. It doesn't really feel like anything. When you feel in the area that we'll come to, you will feel skin, connective tissue, cartilage, and that's all normal. But anything you feel first time through that feels really unusual, like it hasn't been there before or doesn't quite make sense to you, have your doctor check it out. And please know that it's far more likely that you'll be reassured than you'll actually catch something weird that first few times. That's totally okay. Your doctor's not going to begrudge you for that. But there's a massive amount of memory that we have with our sense of touch. So when you do this regularly, you'll know if something is different. If there's a little different lump in one side than the other, you will be aware of that. And if you already know that you have nodules or other structural abnormalities, that's fine. Same thing. You want to detect the changes. You want to know what's different and what's evolving over time. And by checking it each month, you'll be on top of that. And you'll know it as soon as that would occur. So what's the whole procedure? Well, you want to hold the mirror so you can see your neck. You want your neck accessible too. I'm not going to go any further, but you want to get to where you can look in the mirror and see your neck like I'm doing right now. And the basic thing is there's two stages to this. The first one involves looking and watching while you're drinking water. And the second one involves just poking around and see how things feel. I'll give a little more detail here. So as you're drinking water, you want to be able to turn your head in the mirror so you can look at your neck from three different directions. Looking to the left, looking to the right, and looking straight forward. The area in question is going to be between the collarbones here and the Adam's apple here. So those are the lower and the upper borders. And then the side borders are the sternocleidomastoid muscles. I'm trying to get them to show up. There you go. There's one. There's the sternocleidomastoid on that side. And let's see. Yeah, there it is on the other side. I guess the lighting doesn't show up as well. But yeah, there's these muscles that make the borders. So basically, here's the lateral borders, and here's the lower border right there, the collarbones, and here's your upper border. So this is the region in question that you're going to be watching. Now, the rationale here is that as you're swallowing, you're causing your epiglottis to move and expand outward, and it's putting some more traction on the skin. If there was a weird lump, it would make it pop out. It would make it more visible and more obvious. So let's do the drinking stage. I'm looking at my neck, and I'm going to do the first one. I'll do it looking straight ahead. I'll get a mouthful of water first. Okay. I looked at my neck straight on as I took that swallow. Now we'll go to the sides. Okay, right side. And left side. So that was the first step. Now the next step is just palpation. There's different ways to do this. Some will be more intuitive and more comfortable for you than others. Most will use their dominant hand for the bulk of this, and you can go through this in a grid-like pattern. So again, if here's our upper and lower border, here's our side borders. I'm going to start at the upper left portion here and just make a grid pass across. I'm going from left to right. No, wrong way to do this. What you want to do is make overlapping passes. So you want to feel each area a couple of times. And yeah, use your dominant hand so you can kind of work your way down. And this is only, half a dozen passes or so, and you'll cover the area. That's about it. You can also do both hands. Some prefer that. But yeah, dominant hand passes, doing a grid, super simple. That's the procedure. Anything weird, tell your doctor. Go see him and talk about that. I'd also encourage you, use the hashtag neckcheck. I'm going to be bugging y'all on social media on a monthly basis, reminding you to do this. And I'd encourage you to share with your friends. Hey, I did my neck check today. When have you done yours? Hashtag neck check. I didn't make that up. There's others who are using it for the same purpose because thyroid cancer is on the rise. It is largely detectable and it is extremely treatable when caught at early stages. And this is how we catch that. This is how we detect that. So do your neck check. Make sure your friends are doing their neck check as well. And you saw how easy it is. You're looking as you're drinking and swallowing, and then you're poking and feeling the tissues. You know, one thing, if you see something that looks unusual, give that some extra time and feel that a bit more thoroughly and share anything weird with your doctor. That's about all there is to it. All right. Dr. C here with you. Take great care, and I'll see you again real soon. Bye-bye.